Hello and welcome. In this lecture, we're going to be talking a little bit about root cause analysis. So if we think about quality in healthcare, we recognize that there's problems, right? And that there's ways that we can improve our processes, right? So when a problem occurs, we want to think very carefully about what might have caused it and not stop at surface explanations, but really dig in to understand what's behind those potential issues. Now, healthcare has learned a lot from other industries. The airline industry, the auto industry, other industries have systems in place for quality improvement. And we're increasingly using a lot of those methods. And one of those methods, of course, is root cause analysis. So in this lecture, I'm going to be using slides that actually aren't my slides. The references will be there. So just so you know, so just look for those at the bottom of the slides, where we sort of talk through some of the different ideas behind these root cause analysis approaches and the strategies that are used in these processes. All right, so what is root cause analysis? Well, really, it's a structured way of looking at events from a systems perspective. And that systems perspective is really important. Instead of focusing in on individual behaviors or mistakes, right, we're looking at the fact that people operate within a system. And we all know that the environment that we're in has a huge impact on what we do and how we do it, right? We also recognize that systems, very often you're not just looking at single causes, you're looking at multiple contributing factors that result in different types of problems. Now, if you don't have a system, a structured way of looking at this, you might not identify all the potential causes of a problem, right? And if you don't identify all those potential causes, then that problem can occur again, right? So there's real advantages to take this root cause analysis approach. The other thing about this is, again, it's trying to shift our dialogue away from individual blame, although blame sometimes can be appropriate, to really thinking constructively about what we can do within a healthcare system to actually make it safer and improve, create benefits for everyone. So it's a way of shifting our dialogue. So how does it occur? It's a facilitated process. So it's a process, there's different ways of doing it, and we won't go into a lot of detail on the different methods, but it's a structured process where you have an event that occurs and you gather information about the event so that we understand it. We gotta get information from different people involved, groups and individuals are involved in it. Then we start looking for what are the factors that might have contributed to it. Why did that occur, right? And think about that in a broad way. And then think carefully about what our plans or strategies are for addressing those potential factors so that we can actually improve quality of our healthcare systems. So that's why we do it. We do it to figure out what happened, why it happened, and figure out what we can do to prevent it from happening again in the future, and creating those benefits. So, thinking about this in a realistic scenario, a patient received a large dose of phenytoin suspension, resulting in mild toxicity. That's the example case that we're looking at here. Well, an immediate reaction that could occur here would be to blame the nurse. But when this was looked at by a root cause analysis team, they instead found that that there were issues at the systems level that caused this. So an example of that might be that the resident who ordered the drug might be confused about the dose or the software that they were using. The pharmacist might have been finishing the order in a way that while they were distracted. That the medication was supplied in bulk as opposed to units by dosing. So these are different things that you could identify in that situation by looking at the larger system. And by addressing these systemic issues, we could potentially avoid that type of problem occurring again in the future. Again, shifting it from the individual patient and the individual nurse to the larger system questions. Now, one of the big issues that we face in healthcare systems is that there is this tendency towards blaming others. And we've seen that in data that we've looked at, that people are actually very often afraid of being blamed for mistakes that they make. And one of the big responses and the very dangerous responses of this is guilt, where, people become really afraid And sometimes, the dangerous component to this is sometimes they will potentially hide the mistakes that they've made, so that potentially dangerous situations don't get revealed and we don't find out ways to actually prevent them from occurring, right? So, you could view this initial approach to the blame approach of focusing on the individual, punishment, expecting perfection, disciplinary approaches, and only training as opposed to looking at systems, right? That's sort of the blame approach, right? And the goal here is to shift to a different approach, which is looking at systems for why the errors occur, changing those systems, learning from them, and thinking about professional performance in a system, and recognize that humans have limitations, and looking for solutions that might be a range of different types of solutions that you'd consider here. So I think that this second approach, the second column, is really gesturing towards the idea of our just culture, which is that, individuals should not be held accountable and should not be blamed and be held at fault for system failures that they just don't have control over. That isn't a fair thing. That isn't an ethical thing. And it happens all the time. So a just culture is one that tries to recognize these systemic issues. That being said, I should add the caveat that just culture also doesn't accept that people might do reckless or irresponsible things. Those would be actually addressed carefully, and you wouldn't just let those things slide, right? So you could think about different types of problems in different ways. You could have human error in processes, procedures, training, design, environment, and you can manage that in a range of different ways. All right. Through those processes, by improving those processes, training, and environment, and recognizing that these are errors that could occur as a result of that system. You could also think of behaviors that increase risk for harm, right? So that would be unintentional risk taking, and you can deal with this through removing incentives for at-risk behaviors, creating incentives for healthy behaviors, and increasing situational awareness, and generally education around this so that people understand the risks that were being taken and consoling people appropriately. Now, there's sort of this red line between those two elements where you can console and coach and deal with this, and the other side where you actually have reckless behavior, right? And that's where people are doing something knowingly that causes risk. And then you can perhaps take action to help people compensate or, repair the damage that they've done. Or you can discipline them in those situations. And that might be a situation where punishment or sort of a response and consequences might be appropriate in a leadership context. So, and quality improvement context. So this is kind of how we can think a little bit about some of those quality improvement elements. So here is a model that I think is really helpful for when we think about complex systems. All right. It's often called the Swiss cheese model, and you may have seen it before. But the idea here is that we have a range of different elements, right? There's different steps at which errors occur, and there's different steps at which we can catch them before they pass through the system, actually cause harm, right? So think of these each as being slices of Swiss cheese, where there's different holes of different sizes, and each of those holes have basically a probability that a mistake will slip through the cracks. And very often in healthcare, it's multiple mistakes that occur in multiple situations that compound to ultimately result in harm to patients or some other type of challenge, right? So these could be different types of gaps in terms of not having maximum dose warnings, or having language barriers, or other environmental factors, or communication problems. And it's a combination of those, just the wrong combination of those gaps coming together to actually cause harm to a patient. It's not very common that it's a single gap. Very often it's multiple gaps. Now, this also illustrates to us why the near misses are actually really important for thinking about quality improvement. Because if you have something where you get really close to that end harm and it gets caught at one of those stages, so it doesn't get through one of those holes, by going upstream and figuring out what holes it did go through, you can actually gather a lot of information about how to prevent that potentially happening in the future. And by closing up those holes and making them narrower, we're actually improving the quality of our system to decrease the overall probability of something getting through all those gaps, right? So I think this is just a helpful model for thinking and visualizing this type of issue. So, in terms of policy, the Joint Commission has expectations around this. And this is really looking at adverse events or close calls and or sentinel events where there potentially was a very significant harm. And here's a tool for looking at this. It looks at severity and probability. So probabilities along the side, frequent, occasional, uncommon, or remote. Along the top, you have a catastrophic severity, a major severity, a moderate severity, or minor severity. So in terms of expectation for triggering root cause analysis, anything that's in the 3 range, the highest risk, suggests that you should do a root cause analysis. So that would be anything that's catastrophic and anything that happens frequently that potentially could have major harm. And then you could also think about using those approaches for other less serious or less common things, but that's not necessarily required in certain situations. But it is a tool for sort of thinking about what we would do a root cause analysis for. So in terms of the steps of the root cause analysis, that's going to vary a lot. Different institutions have different approaches to doing this, and they can tie it into different methods. We've talked about SWARM. We've talked about other different strategies that have been used. But generally speaking, you're developing some sort of team that's going to gather information, do research on what happened, look for different types of root causes, and then think carefully about what actions you could take to deal with it, and how you can measure whether or not you've actually done that, and provide an opportunity and guide us towards taking those actions so that we can avoid these problems in the future. Now, you may be familiar with a bunch of different strategies that are used in root cause analysis. And here's a list of different ones. I'm going to talk about most of them. But a couple that I don't have slides on brainstorming, you're pretty familiar with that, where you get together and think, talk. There's different strategies for doing this, but getting people to talk openly and fluidly about their ideas about what happened. And benchmarking is also useful for after you have a root cause, you actually get information about what is happening, what has happened in the past, and actually create goals and expectations around what you want to do for that type of issue in the future. All right, so I'm going to go through a few of these different things and talk about why they're important so you're just familiar with them. Obviously, there's resources out there where you can get a lot more information about how to do these different practices. I'm just talking about what they are so you have some general familiarity with that. One strategy that's often used in root cause analysis is the 5 whys. And the overall idea of this is somewhat intuitive. It's essentially the idea that if we just go to the first why, we say that there's a problem and we only look at the first thing that we answer, that we're not going to get the real answer as to why something happened, right? That's going to give us the easy answer and it won't give us the upstream answers. That we actually really have to really push ourselves to go back and ask why each of those elements upstream of that happening actually cause something to occur, right? So the 5 whys is the idea is that by the time you've gone to 5 layers of whys, maybe you've actually gotten to that root cause, right? So the example here is you drive into your garage and you get a flat tire. Well, why do you get a flat tire? Well, if you look at it, you find that there's a nail in your flat tire, and you could stop there and say, well, I have a nail on my tire. Well, it turns out that if you actually keep on asking your whys, well, it turns out that there's a box on a shelf where it's split open, right? So if you had just left it there, those nails probably would have continued to fall and you would have kept on getting flat tires, right? Why did it break open? Well, it got wet. Okay. Why did it get wet? Well, the rain came through a hole in the roof. And why did that happen? Well, the roof shingles were missing, right? So as you go upstream in the 5 whys, you get to the root cause. And if you fix that those roof shingles, you won't expect to see that specific type of problem again in the future. You could actually even potentially prevent other types of problems from leaking as well. So that's the idea of the 5 whys. Kind of intuitive, but it's actually helpful to force ourselves because it's very easy. It's very easy to stop with the first why. And the reason that it's easy to stop with the first why is usually it's the most obvious. It's usually the one that's most associated with blame. And we can often get really excited by that first why. And then just focus in on that and forget that there's other potentially important whys that are also relevant here, right? So another thing that you can do is called a PARETO analysis. And this is when we start finding that there are different types of problems and we see different health problems occurring over time and we see them occurring repeatedly. Well, one thing that we can do is look and see what those different causes are over time. So sometimes we don't always know what the causes are. And as we measure them over time, we could see that certain causes appear more frequently. So this is manufacturing information, General Dynamics, where they essentially looked at the causes of material rejection. And what they found is that there's a whole bunch of different ones there. There's probably 20 different causes of material rejection. However, it's very often the case that for certain types of issues, that the majority of those rejections are actually found in a small number of potential causes. So what this does is it focuses you in on the vital few and helps you separate them out from the trivial many. So you can handle those trivial many, right? But if you focus in on those vital few, in this case, you would account for almost 60% of your problem, right, by doing that. So PARETO analysis is a prioritization technique for identifying what's going to be most effective for you to focus in on first in terms of dealing with your quality improvement problem. When you're dealing with a problem, another really helpful tool is just creating a flow diagram of what occurred. So this is a timeline. This one is about heparin, for example, and looking at major bleeding and sort of the timeline of how this occurred. The timeline is going to be helpful because it helps you to determine the trajectory of what occurred. And as you think about the Swiss cheese model and the different ways in which areas in which things could have been prevented, the timeline is going to be crucial to that for identifying the potential problems, right? So this also is really important for creating a shared understanding of what occurred. And sometimes having that shared understanding from multiple views helps us to take an objective view of a quality improvement issue as opposed to the blame-oriented view, right? You're not really understanding a problem if you're not understanding the complexity of the situations and the decisions that were made, right? So understanding why decisions were made is really important to understanding the problem and who people are and moving away from the blame framework. And the timeline and understanding what occurred really helps with that. So when you think about a healthcare system, if we're moving to analyzing that healthcare system, there's a range of different things that you could look at. People, you could look at education, training, orientation, staffing type elements. You could also look at materials, medications, dressings, other supplies. You can look at medical equipment, tools, documentation forms, communication tools, or you could look at methods like policies, procedures, communication practices, coordination, management practices. So these are all just different elements that one would think about in a healthcare system and try to address, right? So thinking again about these many different opportunities for improving quality. Now, when you think about a system, you would want to try and address all of those different elements. Now, it's true that more of the causal problems might fall into one of these different 4 groups. But if you think about all of them carefully, you might find things that you weren't thinking about initially. So if you're thinking about anticoagulation, right, you could look at all these different methods, people, equipment, and materials, and think about how they play into the trajectory that led to this anticoagulation event. When you're also looking at this, right, and you're looking at poor safety performance, you can also use tree diagrams where you try and chart out essentially the chain of events and how they contributed to each other to result in a negative outcome, right? So very often there's different types of causes, again, thinking about the 5 whys, that align together to result in a poor outcome, right? So this is something that is another helpful method. Now, once we think about and have identified a lot of the causes and sort of the structure of how this occurs, one would want to think about how knowledge and performance errors could be trapped and create safety systems so that they don't occur in the future. And that's called an error trap, and thereby prevent accidents from occurring. It's important to note that people make mistakes, and there's actually sometimes relatively high rates of human error. So this is industrial information, but this is looking at different types of errors that occur. Everything from, errors of omission without reminders, monitoring, math errors, other things like that. I'll note here that one of the error rates, the highest risk error rate, is general area in high stress when dangerous activities are occurring rapidly, which can, in certain healthcare situations, happen relatively frequently, right? So the idea here is that errors do occur, and we can't take the approach of thinking about human error as being something where we just need to be perfect and errors won't occur. Well, people make errors, and we need to expect that people will make errors. And it's not necessarily when people are tired and certain situations occur, there's high stress situations. It would be a mistake to view a healthcare system as something that could be error-free. You're better off viewing it as something where you'd expect the error to occur and figure out how, if an error occurs, how we can prevent that from going down through that trajectory and getting past all the checkpoints to actually result in harm. Okay. So how do we avoid human error? So we saw that a lot of those error elements might relate to memory errors, that relate to memory or vigilance, right? So we can avoid that by having protocols and checklists. We can create processes that are simpler, right? So if we look at the processes and see that there's problems that make it complex or make it hard to remember, then we can simplify it. We can create standardized procedures and avoid variation. So a big thing in healthcare is creating consistency in terms of how we do that in evidence-based practice, right? So decreasing variation helps us to identify problems, right? Because if you have consistency of implementation, then you know that it's not because different people were doing things in different random ways. You can actually look at a protocol and shift it to deal with that problem. And using different types of constraints or systems that are put in place to force certain types of recall or checks around a potential error. Okay. So that's just a quick introduction to root cause analysis and thinking about quality improvement in healthcare. I think that this is a really fascinating approach, and it has tremendous potential to address a lot of these real serious issues. So we've looked at some of the data around preventable harm in healthcare, and we know that it's much, much higher than it should be. We're looking at, I think it was something like 1 in 200 patients dying of preventable harm, and 1 in 20 patients having some sort of harm in healthcare settings, right? These are too high, and we want to think carefully about what our strategies are for addressing those problems before they occur. And these are some approaches that have been found to be pretty useful and sort of make sense to me. So I hope that this was sort of a helpful introduction. I know it was really quick and we just sort of went through it, some basic ideas, but each of these elements you can go and do some more research and learn these different strategies for addressing root cause and finding out what is the upstream thing that is causing this quality issue. All right, so that's about it. Thank you all for listening. I hope it's helpful, and take care, everyone.